Tetralogy of Fallot is a congenital heart defect that is present at birth. It is a combination of 4 heart abnormalities that result in oxygen-poor blood being pumped out to the body. Below are detailed notes on Tetralogy of Fallot. Components of Tetralogy of Fallot include ventricular septal defect, or VSD, which is a hole between the right and left ventricles, allowing oxygen-poor blood from the right ventricle to mix with oxygen-rich blood from the left ventricle. Then, there's pulmonary stenosis, which is the narrowing of the pulmonary valve and outflow tract leading from the right ventricle to the pulmonary artery. This restricts blood flow to the lungs and forces the heart to work harder. Next, we have right ventricular hypertrophy, which is the thickening of the muscular walls of the right ventricle due to the increased effort needed to pump blood through the narrowed pulmonary valve. Lastly, there's the overriding aorta, where the aorta is positioned directly over the ventricular septal defect, receiving blood from both the right and left ventricles. This means that a mix of oxygen-poor and oxygen-rich blood is circulated throughout the body. Symptoms of Tetralogy of Fallot include cyanosis, which is a bluish tint to the skin, lips and fingernails due to low oxygen levels in the blood. There's also difficulty breathing, which can manifest as shortness of breath or rapid breathing, especially during feeding or exercise. Fatigue is another symptom, where the individual easily tires during play or activity. A heart murmur, which is a whooshing sound heard through a stethoscope due to turbulent blood flow, is also a symptom. Lastly, clubbing, which is the enlargement of the tips of the fingers or toes, can occur. Diagnosis of Tetralogy of Fallot involves several tests. An echocardiogram, which is an ultrasound of the heart, is used to visualize the defect and the flow of blood. A chest X-ray is also performed to view the structure of the heart and lungs. Additionally, an electrocardiogram, or ECG, is used to check for abnormal heart rhythms. Finally, cardiac catheterization involves the insertion of a catheter into the heart to get detailed information about the heart's structure and function. The primary treatment for Tetralogy of Fallot is corrective surgery, typically performed in the first year of life. This involves intracardiac repair, which includes patching the ventricular septal defect and widening the narrowed pulmonary valve and outflow tract. In some cases, a temporary shunt may be placed to increase blood flow to the lungs until a full repair can be performed. Medications are also used to manage symptoms before surgery or if surgery is delayed. These may include beta blockers or prostaglandins. After corrective surgery, most children lead relatively normal lives, though they may require ongoing follow-up with a cardiologist. However, potential long-term complications can include arrhythmias, pulmonary regurgitation, and residual defects that might require additional surgeries or interventions. Lifelong follow-up with a cardiologist specializing in congenital heart defects is crucial. Patients may need to avoid strenuous activities and may need to take antibiotics before certain dental and medical procedures to prevent endocarditis. Tetralogy of Fallot is a serious but treatable condition. Advancements in surgical techniques and medical care have significantly improved outcomes for affected individuals.